Going back to school can be stressful, and we know stress can trigger breakouts, something teens are already prone to. Dr. Sherry Ingraham with Advanced Dermatology is here, though, with ways to combat acne. Good morning to you.
Good morning.
What is it about back-to-school activities that can cause acne flare-ups?
You know, it's a combination of so many things. It's that perfect time of year. It's hot and humid. So dirt, debris, oil, and humidity impact our pores. Everything's kind of sitting on top of our skin. And then you add to that the stress of getting ready for school. So hormones in our body are stimulated essentially by stress. Stress-induced hormones stimulate our sebaceous glands to release more oil. All of that combines to clog our pores.
Okay, so what can we do to avoid it?
So I treat a teenager going back to school, or even someone in their 12s, 13s, a young tween, differently than I would an adult. Typically, they're more oily, so you want to look at oil-busting face washes. I like Neutrogena Acne Wash because it has sal acids. You want to look at products with 2% salicylic acid, also products that are designed for oilier skin. La Roche-Posay has some good gentle cleansers that are designed for oilier skin. You also want to use a retinoid at night. Retinoids are vitamin A derivatives that open up those pores and help to purify the skin, get out some of that clogging oil debris that causes acne. Neutrogena has a great new line of retinoid products at night, stubborn acne, that you can get at the drugstore. But one of my favorites is a prior product that was a prescription, which is Adapalene, which you can now get as an over-the-counter product as well by La Roche-Posay. These are also retinoids to use at night that are gentle for teens. Another important thing is kind of lifestyle. So you're getting ready to go back to school. We're wearing masks. You want to wash that mask at least every other day. Preferably have 7 masks, 1 for every day, and wash it every day because you're sweating, you're talking during the day. You want to keep that mask nice and clean. And then, of course, if you're doing sports, back to school sports are busy right now. So you want to take a wipe once or twice a week, wipe out those gym bags. Those gym bags can have an old towel in it that has bacteria on it. There's nothing worse than a warm towel sitting in your gym bag all day to harbor bacteria.
Oh, it sounds disgusting, doesn't it? Okay, so we've talked prevention, but let's talk about treatments, because if you're beyond that and the kid is still having a lot of problems, we know it can hurt their self-esteem. So what can you as a doctor help them do to get over this?
Yeah, I always say my job as a physician is to prevent scarring. Acne is very, very detrimental to anyone, but especially a young person's self-esteem. And so we want to help prevent acne and scarring, hyperpigmentation, and of course, blemishes. So if you're at the point where you're noticing your child is depressed, if they're concerned about their acne, if they're picking at their acne a lot, which we want to avoid because it can cause scarring, make an appointment with a board-certified dermatologist. We like to start them often on combination products that combine some of the over-the-counter products in a stronger form, something with a retinoid in it, also oral antibiotics, and even times Accutane, which is a wonderful medication that can really change lives and prevent scarring and acne. Also, in young women, often using oral contraceptives, also using other medications like spironolactone can affect the hormone drive in acne and can also help prevent facial oiliness as well.
All right, Dr. Ingraham, you have some homework for the kiddos on some of their first day of school of how to better take care of that skin, but hopefully it'll take a lot of stress out for them. They're great tips. Thank you for sharing those for us today.
Thank you for having me.
All right, have a great day.